Hi, this is Tina Vest, and I will be presenting the Doctor of Nursing Practice Project at Maryville University, the Catherine McAuley School of Nursing. The title of this DNP project is Enhancing DBT Skills Training in Adolescents age 12 to 17 to Improve Depression, PHQ-9, and Anxiety, GAD-7 screening scores. I would like to welcome the committee. I would like to thank Dr. Gail Pitroff, my DNP project chair at Maryville University, for your mentorship, encouragement, and support. I would like to thank the faculty and staff. Special thanks to the faculty at Maryville University for their guidance, and in particular, Dr. Lisa Sturr for her insight on this DNP project. Next, I would like to thank my site mentor, Dr. Leslie Miller. I cannot express enough gratitude to my faculty site liaison and mentor, Dr. Miller, for her invaluable wisdom, guidance, and strength you have given me as I have pursued this project. I'm grateful for your time and dedication. And last, to the site and the participants, I would like to thank the site staff for allowing me to conduct this study, and to the participants who shared their time and experiences. Dedication. I would like to dedicate this project to my son, Tyler. You are my strength and inspiration, and you're also my rock. Thank you so much. And also, professionally, I would like to thank all the nurses. This project is for you. Thank you. With the introduction to this project, I would like to share that adolescent depression and anxiety is on the rise nationally. Youth aged 12 to 17 have been having increasing emotional dysregulation, academic impairment, and social stressors. The Adolescent Intensive Outpatient Program, which is the site that this project was done, showed minimal improvement in the PHQ-9 and the GAD-7 screening scores, which is the depression and anxiety scores. With showing the minimal improvements with the depression and anxiety in adolescents, there was an identified need for a structured evidence-based intervention of DBT skills training curriculum by Marcia Linehan in 2015. The background and significance of this DNP project is shared with adolescents and their mental health disorders, and it shows that there are 1 in 5 adolescents that are affected by the mental health disorders, and that's according to the CDC in 2023. It's also associated with emotional dysregulation and depressive symptoms in adolescents. So the project site, the Adolescent Intensive Outpatient Program, with this identified minimal improvement in the PHQ-9 and the GAD-7 screening scores, sparked an idea and also a way to look at root causes. And then the root cause analysis showed this inconsistent and non-standardized DBT delivery within that program. The aim was to improve depression and anxiety outcomes using a structured DBT skills training. The problem statement: adolescents enrolled in the Adolescent Intensive Outpatient Program demonstrated minimal measurable improvement in the depression and anxiety scores. Therefore, looking at the need for this standardized DBT skills training. The purpose of the project was to address this practice gap related to the inconsistent DBT delivery and the lack of measurable improvement in mental health outcomes by introducing this structured evidence-based DBT curriculum to enhance treatment effectiveness, improve patient outcomes, and support data-driven quality improvement within the clinical setting. The specific aims of this project was to determine whether the implementation of the structured DBT skills training curriculum would significantly reduce the PHQ-9, the depression, and the GAD-7 anxiety screening scores among the adolescents aged 12 to 17. And then upon further review and looking at that root cause analysis, it identified these inconsistent implementation of DBT, including once weekly delivery using modified, non-standard video-based materials rather than using structured, evidence-based DBT curriculum. The problem and the gap affected these patient outcomes, limited the staff's ability to evaluate the treatment effectiveness, and it reduced the organization's capacity to demonstrate quality improvement. The review of the literature from this project shows that DBT improves emotion regulation and depressive symptoms in adolescents. DBT skills reduce self-harm and enhances psychosocial functioning. With this project, the PHQ-9 and the GAD-7 screening scores, these were outcome measures that were found in the literature to be valid and reliable. Evidence also showed in the literature that there were stronger effects for depression versus anxiety in the short-term DBT skills. Also in the review of the literature, it showed evidence-based intervention of DBT skills training curriculum by Marsha Linehan in 2015. And it focused on these 5 core concepts that you'll see on the left-hand side there: mindfulness, emotion regulation, distress tolerance, interpersonal effectiveness, and walking the middle path. So these were all areas that greatly needed help with the adolescents, and DBT skills, these were what we needed for this program. The theoretical framework started with the Plan, Do, Study, Act, the PDSA framework. And in this Plan, Do, Study, Act, it was guiding the identification of this practice gap, the need for a more structured DBT skills, the implementation of the DBT intervention, evaluation of the outcomes, evaluating the PHQ-9 and the GAD-7 screening scores, sustainability of the planning in the plan phase. So in looking at this Plan, Do, Study, Act framework, we placed this into the project, and the plan for the project was to identify the root causes, which found that minimal symptom improvement. And that was very important in that planning phase. The do part of this framework was to implement the structure of the DBT skills twice weekly, from that once a week, just YouTube videos and handouts. Now we're doing it twice weekly in a structured environment. The study part of the framework was to analyze that pre and post PHQ-9 and the GAD-7 screening scores. The ACT phase of the PDSA was to sustain and refine the interventions based on the findings, getting that data and then refining things. And then the other part of the theoretical framework we used was that root cause analysis and looking at the patient factors, the provider factors, the process factors, the system factors. And in the patient factors, looking at that high baseline severity, the comorbid psychiatric diagnoses. We found other diagnoses, which was OCD, obsessive compulsive disorder, and autism spectrum disorder. And then also with the patient factors, we found that variable engagement, where some patients were having a hard time engaging in care and in therapy. Next, the provider factors, that inconsistent reinforcement of the DBT skills. So within the clinicians, the inconsistent practices. Also, the variability in therapeutic approaches within the clinicians. So having more of a structured DBT skills training also helped with the clinicians to be stronger in their practices. Next, with the process factors, the lack of the standardized curriculum sequencing, the limited structured outcome monitoring. There was no monitoring of the depression and anxiety and finding out if things were improving or not. And then last, the system factors with high program acuity and no formal feedback loop. So there was no feedback prior to this study and finding out if, in fact, did this program work in improving depression and anxiety. The methods and design. The design was a quantitative, retrospective, pre-post quality improvement study. The setting was an urban adolescent intensive outpatient program in the northeast of the United States. The sample was 115 adolescents that were all aged 12 to 17. The duration was a 16-week implementation period. The intervention was the DBT skills training, and they were being done twice weekly with the Marsha Linehan's DBT skills training curriculum. The outcome measures were the PHQ-9 and the GAD-7 questionnaires, and that was looked at for the validity and the reliability, and that was by Kronicki et al., 2001. The sample was a number of 115 adolescents. They were all aged 12 to 17. Inclusion criteria was also to have a complete pre and post PHQ-9 and GAD-7 scores. So we had to make sure and maintain that each participant had both the pre and the post scorings of each PHQ-9 and GAD-7. And then last, the descriptive statistics was used to summarize the sample characteristics. Data analysis. Looking at the statistical analysis on the right-hand side, the statistical analysis that we used for this project was a paired samples t-test, which was two-tailed and with the p of a 0.05 threshold. And then on the left-hand side, this descriptive statistics with those pie graphs of both the PHQ-9 and the GAD-7, which was showing improvement, no change, or that worsening of the depression or anxiety. So on the first pie graph on the left-hand side, the PHQ-9, which is figure 1, shows the descriptive statistics of both those PHQ-9 and GAD-7 pre and post interventions, and again showing either improvement, no change, or worsening of either the depression or anxiety. So in figure 1, there were 57 out of 115 teens that equaled 48.7% that showed an improvement in depression. So the PHQ-9 was for depression. So if you look at that pie graph, the blue shaded area, which is 48.7%, showed improvement. The orange shaded area, which showed 18 teens out of 115 that equaled a 15.4%, showed a no change in depression on that orange shaded area. And then last, 42 teens out of 115, equaling 35.8%, showed worsening depression in that green shaded area. And then if you take a look at the pie graph at the bottom, which is the GAD-7, some of the results that we got from the study showed 44 out of 115 teens, which equaled 37.3%. And that is the improvement in anxiety. And you'll see that is the blue shaded area of that pie graph. 37.3% showed improvement in anxiety. And then in the orange shaded area of that GAD-7 pie graph, 16 out of 115 teens, equal 13.6%, showed no change in anxiety. And then 58 out of 115 teens, equaling 49.2%, and that green shaded area showed the worsening anxiety. So for both of those pie graphs, for the PHQ-9 and the GAD-7, you can see the opposite effect. So half of the pie graph for the PHQ-9 with the blue shaded area identified improvement in depression, and the GAD-7, the green shaded area, which is almost half of that pie graph, showed worsening anxiety. So that was pretty interesting on the results. And next on the results for the pre and post intervention for both depression and anxiety. So we'll start with depression PHQ-9 questionnaires. The pre-score was 14.70 and the post score was 13.00 with a P of 0.001, which is well under the 0.05 threshold, showing a statistically significant improvement in depression from the results. And then underneath that is the anxiety, the GAD-7 questionnaire scores. And the pre-score was 10.70 and the post-score was 9.90, which a P of 0.09, which is just a little above the 0.05 threshold, showing a modest improvement in anxiety. However, it was not statistically significant because it was above that 0.05 threshold. And then on limitations of the study, there were some limitations showing a single site setting. There was no control group. This was a retrospective design, which was a limitation as well. And then last, the short evaluation period of 16 weeks was a limitation in this study as well. Discussion. From this study, we have seen that the DBT skills training significantly improved the depressive symptoms, and showing that from our results and outcomes. It was pretty impressive with improving depressive symptoms. It showed anxiety outcomes may require a longer duration or a more targeted refinement, expanding that study time and maybe adding in some other additional testings or resources to see if we can help improve anxiety. The findings do, in fact, support the integration of the DBT skills training curriculum by Ms. Marsha Linehan as being that standard adolescent intensive outpatient program practice. So this will be implemented into practice. It showed an increased group engagement and coping skills, which was fantastic. When looking at the root cause analysis in the beginning of this discussion, showed variability in engagement. So seeing that increased group engagement and increase of coping skills and holding each other accountable, the peers, and seeing that in the group sessions was incredible. And then last, monitoring for external stressors and implementation into school, and then also with family meetings to further help with both depression and anxiety, but looking at ways to improve in anxiety with using schools and families. I'm going to look at the quintuple aim, the improvement in population health, enhancing patient experiences, reducing healthcare costs, and looking at this with improving depression and improving anxiety, helping patients to feel better, not return, not have to come to the program as often. And then also that improving that work-life balance with our clinicians. As the teens were feeling better, the clinicians were feeling better, and they were improving their work-life balance. So what a way to support the clinicians as well in this study. Implications for practice. This project definitely shows from the results in the study that it supports advanced practice nurse leadership and the quality improvement initiatives, demonstrates the value of the Plan, Do, Study, Act and the driven implementation for science. And then last, reinforcing evidence-based practices within the adolescent behavioral health realm. Implications for further research and sustainability: continue twice weekly DBT skills groups, quarterly outcome monitoring reviews, any additional Plan, Do, Study, Act cycles targeting anxiety outcomes. We'll be doing some more research on that. And then maintaining standardized curriculum sequencing. So we're going to maintain this standardized twice weekly DBT skills training within our program. Conclusions: implementations of structured DBT skills training within the Adolescent Intensive Outpatient Program and how it's resulted in statistically significant reductions in depressive symptoms, and it's demonstrated the effectiveness of the Plan, Do, Study, Act, which guided quality improvement framework. The impact of the DBT skills curriculum has helped with looking at the PHQ-9 and the GAD-7 results to guide treatment, improve life satisfaction within the clinicians and the teens, and engagement with families as well in doing some family work and training for the parents and the caregivers. In the future, with the results of the modest improvement in anxiety, what our adolescent intensive outpatient program would like to do different is to add in additional therapies for anxiety and referrals to the occupational therapist to address anxiety stressors in life, at school, and at home, looking at some sensory strategies as well, and looking for opportunities to help the teens with their emotion regulations and distress tolerance with organizing their day, organizing schoolwork. Based on this work and moving forward in the future, the Adolescent Intensive Outpatient Program would like to expand the services to the outpatient therapy, schools, and primary care. Personally, the DNP program has assisted me with the process of research and how to determine a clinical practice issue, how to do a root cause analysis, going to the literature for evidence-based interventions, implementing the process, obtaining data, studying the data, acting on the findings, and placing this into practice. This education will drive me forward in doing research in child psychiatry to make the lives of children and families better. Would like to show my poster presentation that I designed in doing this project, and showing that to you as well and for display. Take a look at my references from this presentation. And I would like to thank each and every one of you, the Maryville University, and the teachers. I am extremely honored to have been in this program, and I will take all of this information, research, and the ways that we have helping our teens. I will take this. So thank you very much. I appreciate you listening to my project and the outcomes. Have a great day.